last 2.5 months, before we opened up, we were working on doing the ribbon skirts and shirts and the medicine bags for our clients to give out, the ones that will be graduating. And when I say that they're graduating, I don't mean that we no longer keep in contact, because that's not the case. This is a 3-year grant, and we're starting year 3, and we still got clients from day 1 that we talk to on a weekly basis. So that support system continue to follow that individual, but as far as treatment, they're at the point they no longer need treatment. We've increased a lot since COVID with our rates, our numbers, because during COVID we weren't out in the community, and being able to have that one-on-one connection with people, because we have so many families that's hurting today, this week alone, with overdosing and family members passing away. So we'd like to see those numbers make a dramatic decrease. Granted, we would love to have more clients because we know the need's there.
Going back to April of 2020, and the reason I go back to April is because that's when at Southeastern we had our first COVID death. And I just want to give you an idea of the numbers that he reported. And again, these numbers are probably not all inclusive, but just what the pathologist at Southeastern was seeing. So in April, we had 2 deaths from COVID. There were 9 autopsies done for overdose deaths. May, and COVID was gaining momentum, and as you would expect, the number of deaths per month gradually increased. But with overdose deaths in May, there were 7. June, there were 8. July, 4. August, 3. September, 6. October, 4. November, 3. And December, 3. And again, these are overdose deaths that underwent autopsies at Southeastern. As you can probably imagine, there were also cases that were transferred to Raleigh for the state medical examiners to autopsy as well. Since December of 2020, the data has not been as specific, but he tells me that since December he has done approximately 32 to 34 autopsies and has probably sent out somewhere between 15 to 20 autopsies to the state medical examiner. So again, I know that COVID has taken the headlines locally, regionally, statewide in the U.S., but really and truly this opioid substance abuse, opioid addiction has been with us longer, and probably has not gotten the attention that it really needs. The concern with providers, and I think we're seeing this somewhat, is that with the decreased access and numbers of opioid prescriptions, that a lot of these patients are turning towards non-prescription medications such as fentanyl and heroin. And I'm not exactly sure, but I'm almost certain that a lot of the overdose deaths and these autopsies that I'm talking about were directly related to heroin and fentanyl. But again, as I say, it's more than just the medical community. It's our community as a whole that really needs to come together to combat this problem.
Have everything you need for the weekend. Okay. Well, that's great. That's great. It's awesome to have a support team. So if you know anyone that needs service, please don't hesitate to call. Anytime a client comes in here, everything's 100% confidential. We are that client support person from the first day of treatment till their last day. We've had a lot of success stories with clients. We've got some that's currently graduated out of treatment, that have graduated from college, got new jobs, got family interaction back that they've wanted for years they didn't have. So we've had a lot of success, but we would love to see so much more. Any family member, friend, or anyone you know that needs service, please refer them to us. We'll meet them where they're at. Our expectations is not to change them overnight, and that's not what anyone's looking for. We're gonna meet you where you're at and help you along this journey. We'll learn together. We'll learn along the way, because I tell all my clients daily, what works for you may not work for somebody else, and what works for them may not work for you. This is a personal journey, and we're gonna learn it along the way. We have a lot of outstanding programs in the community, and I'd like to see all of us work together just for the benefit of our people. 3 more complete. How many more is on the list? Is this it?
No, there's about 4 more.
Okay.